Hey everybody, Prepper Nurse 1 here. Today is still Thursday, February 6th, 2020. I just messed it up the first time. I had to start a second time. So, I don't know, I said September for some reason. I don't know what I was thinking. Hello, yes. So I have to show you first of all, and I got come on, let's go. My new slippers that were just made for me by one of my subscribers. I have them on, and I have to say, guys, I'm going to tell you, they're very, very comfortable. And they are very warm. So, yes, I am wearing them. They're fantastic. I have to talk about that real quick. I'm sorry. I put them on today, and I was like, oh, these are nice. So, all right. So, we're going to talk in the video. We're going to talk about protecting healthcare workers, okay? As a nurse of 25 years and a C.N.A. for 5 years before that, I have a little experience with, working in the medical field, obviously, so I could attest that I know what I'm talking about with healthcare workers. And, healthcare workers are not watched after. They're not taken care of. I can tell you that right now. And I'm going to have certain people who are going to jump on here and say, no, that's not true. But you're going to watch the comments, guys. I want you to watch the comments. I want to hear from my C.N.A.s. I want to hear from my LPNs. I want to hear from my RNs who are on the front lines that are working their butts off day in and day out. That's the comments I want you guys to read, because they're going to agree with me 100%, okay? Management does not care about staff at all. Never have, never will. It's all about the bottom line with management, okay? It's all about that dollar. It's all they care about. They just want to have a warm body in there. They don't care if you're exhausted. They don't care if you're overworked. It makes absolutely no difference to them, as long as they can cover things. And if you look at some of these facilities and the minimum staffing standards that they have, and I'm going to give you an example, give you a great example. One facility that I worked in, which I will not name, that was taken over, it was a county facility that was taken over by a company out of New York City, and they are buying up different facilities around, okay? And their minimum staffing, okay, and I want you to think about this, okay? You have a unit with, I'm trying to think how many residents were on the unit. It was between 50 and 54 residents on the unit, okay? It's a lot of people. Not everybody's at the same level of care, obviously. You have some that are full care people, some are not. But this particular facility, their minimum staffing was that you could have three. Now, I was working an evening shift. You could have 3 C.N.A.s and 1 nurse. That was their minimum staffing. So if the other nurse, you're supposed to have at least 2 nurses on the floor. If 1 nurse didn't show up, they expected the 1 nurse to take care of 54 people, meaning pass meds, do treatments, do whatever paperwork, and heaven forbid that there's an emergency, take care of that. There's supposed to be minimum of 4 aides on, usually 5 aides on the evening shift, okay? Because you're getting everybody ready to get them to bed, get them cleaned up. They had a certain number of showers that had to be done. A lot to it. I mean, I could really get into it and explain it better, but it's nightmarish, okay? But if they were short-staffed, then they would say, it's okay to have 3. So you would have 3 aides trying to take care of, get cleaned up, get people to bed, and when you have a Hoyer, a person that's using a Hoyer for transfer, it takes 2 C.N.A.s to do that transfer. So you're figuring with that 1 person, it's going to take, those 2 C.N.A.s minimum of 10 minutes to get that person into bed, get them squared away, get them situated. So in that case, now you have those 2 tied up with that 1 person, and the other aide is trying to do other people in the meantime. It's a nightmare, okay? So that's what the staffing was in this facility, and they could care less. They were burning through nurses I'll tell you what, I worked there for a grand total, I think 3 weeks before I quit, because I'm like, I'm not doing it. It was unsafe, very, very unsafe. I was not going to risk my nursing license because, and then what happens is, if something happened on your shift, they'd throw you under the bus in a heartbeat. So I want to give you a little background on that, okay? So we're going to talk about, let's go into modern, what's going on right now, okay? You have this situation over in Wuhan, China. Socks, please stop. You're driving me nuts. Not stop. Not tonight. You have this situation over in Wuhan, China. Okay, and this doctor, the whistleblower. Now it is confirmed now that he did die from the coronavirus. He was 33 years old. Now I'm being told, I've saw the official thing that he died of a heart attack. 33? Come on. Okay, he died from the coronavirus. Now the thing with that, which is disturbing, is you're talking about somebody that is Soxy. I said no, not right now. I'm busy. You're talking about she will not stop. She's absolutely crazy. She loves her attention. You're talking about a person that's on the front line, medical field person that would probably get the best care that they could possibly get, and this gentleman still died. Okay, he contracted the virus. He was trying to let people know. He was trying to warn people. He was reprimanded by his government and his higher ups. So think about it. Okay, there's that old saying, "SH rolls downhill," and it's very, very true. The higher ups sing the mantra, and either you follow the line or you get thrown under the bus. That's how they work. Okay, so this individual is now dead. This doctor, Dr. Lee, L.I., I believe is how you say his name. If I'm saying it wrong, I apologize, but he's now dead. All right, 33 years old, had a wife, a child, and I think another child on the way. What an absolute waste! What a very, very sad thing. And because they had to follow the official protocol. See, this is where the problem is. You're putting people that are taking care of people's lives in jeopardy. That's the problem. Okay, and this happens, guys. Every facility, all across the country. And again, I want to hear from my nurses. I want to hear from my C.N.A.s out there. They know. They will parrot the same exact thing. You're talking double shifts, a lot of double shifts, long hours. Overworked, understaffed. You are not able to give the proper care to people that you would like to give or that you want to give. You can't take the time with people that you would like to do because of what is going on. So I got a couple things I wanted to mention here too. And I'm going to mention Choo Choo Rooterbean once again because he just came back from that cruise. He got back the 21st, I think it was the 21st of January. He's really, really lucky because right now, outside of Japan, they got that one cruise ship under quarantine. 10 more people have tested positive on that ship for the coronavirus, okay? That's a freaking nightmare. And they're telling people to quarantine in their rooms. I mean, it's a nightmare. And you figure, too, guys, these ships made ports of calls different places, and these people all went out and did intermixing and being out with other people, too. How many more cases are going to come off that ship? There's another ship right now in Hong Kong that is under quarantine with 3,600 people on it. Now, the first ship in Japan, I think it's 7,000 people, okay? Now, the second one is in the second day of quarantine after 3 positive cases on that ship. So, that is absolutely scary. Now, the new numbers just came in, the official numbers. We're not going to talk about what the real numbers are because we're not ever going to be given the real numbers. They're saying 30,818 people confirmed cases of the coronavirus, 634 people dead, and they're saying 1,487 people have recovered. Now again, is this true? Is that accurate? I very much doubt it because of everything that's been going on and everything that's been happening. We're not given the true numbers. We're not being given the scale of how bad this is. And, these poor nurses and doctors and aides over there in China, they are being slammed. They're probably working at least 16-hour days. They're probably being forced to stay at the hospital. They're probably trying to get a little bit of sleep. Well, they might even be able to forced to be work longer over there. I don't know. I don't know what the protocol in China is. But here in the United States, you can't work, well, technically, I'll say technically, you're not allowed to work more than 16 hours. It happens all the time. It happens all the time. But and then without an 8-hour break. But they can force you, if there's like a weather emergency, if you're in a hospital facility, you have to stay. You work 16 hours, and then you're supposed to get 8 hours of rest time. But again, You do that. Try doing that for 3-4 days and take care of people, and do that for a living, lifting people and washing people and cleaning people, feeding people. The whole gamut of taking care of people. It's a nightmare. It can be an absolute nightmare, and I think a lot of people don't realize how hard medical staff works. Okay, medical staffs, now we'll throw in too. Let's not even forget these guys are respiratory therapists, especially in this situation which going on because we have a respiratory disease over there in China, right? So you're talking a respiratory therapist, you're trying to save people, trying to give them breathing treatments to open up their airways. Absolute nightmare, guys. Got to be an absolute nightmare. I feel so bad for not just the patients over there. I mean, the information that's coming out, people are being turned away from the hospitals because there's no room in the hospitals. No room. So they're being turned away from the hospitals. What is going on? You know what I mean? I mean, how bad really is this thing? That would be my question. There's a lot of unanswered questions. There's a lot of things that are very, very concerning that are not being addressed. And of course, higher up officials are going to cover everything up and lie. That's what they do. I've seen absolute blatant lies of why different things happen as a direct result of things happening. Just very, very sad. The facility that I talked about, the one facility that I worked at for 3 weeks, we had to do nursing notes. And so that particular night that we worked, when we were short-staffed, and like I said, I refused to take the whole floor, wouldn't do it. So they had to bring somebody else down there to work the other side of the floor. We had a situation, we had 3 aides that night, taking care of 50 some odd people. We had, the 2 girls were putting Hoyer patients to bed first. The other girl, okay, so the 2 aides were very, very strong aides. The other aide was a very, very weak aide. And that's another issue that comes into play, which they don't think about. They think, well, there's 3 aides on. Well, when you have 1 aide that is basically worthless, now you realistically have 2 aides on. So the 2 aides were putting people to bed. This other girl was doing whatever she was doing. And this lady had wanted to go to bed. She had asked like 3 times to go to bed. And they were like, well, Mrs. So-and-so, we're going to have to wait. We'll come and get you as soon as we can. Because they were slammed, okay? What ended up happening was this woman tried to take herself to bed, fell on the floor, shattered her elbow. Destroyed her elbow. To the point where they were not going to be able to do surgery or anything to fix this woman's elbow, okay? I was so upset about this because it was a direct result of being short-staffed. I wrote my nursing note, and I put in there, this is a direct result of being short-staffed. And boy, they tried to chew me up for that, and I said, I don't care. I could care less, because there's the thing with me. I have principles, and I have guidelines that I live by, and if I feel something's not right, I'm going to say it. So, our medical staff around the world, and in this type of situation, what is going on over there, they're not being protected the right way. And I'm going to tell you what, if this thing blows up and goes crazy, you're going to see a lot of medical staff bail in the United States because they're not going to risk their life, and they're not going to care, and I don't blame them. Because guess what? Again, management don't care about them, okay? They shouldn't be risking their lives. They shouldn't be putting their lives on the line. So, I wanted to do this video after seeing and confirming that the doctor did die. I think it's terrible. Like I said, I think they're trying to say it's a heart attack, is what their official mantra is, that it's a heart attack, which is total crap, okay? 33, come on. So, it wasn't like he was a great, big, huge, fat guy either, because he wasn't. So, anyway, I want to hear what you guys have to say. I definitely want to hear your feedback on this. I will say again, I want to mention really quickly, on my website right now, we are still doing the sale for the Legacy freeze-dried food. That is going to continue on until Sunday. That is ending on Sunday. So if you're looking to save 20% on the freeze-dried food, go to my website at preppernurse1.com. Once you go in there, whatever prices you see, 20% off will be taken off at checkout, except for the sample packs. It's the only ones that are not on sale. Everything else is on sale. So if you are interested, please go over there, check that out, take advantage of that if you want to add to your freeze-dried food storage. I'm going to tell you again, guys, and I've been harping on this for probably almost a little over a week now, prepare to shelter in place. This thing is no joke. We don't know how truly bad it is yet. I think it's a lot worse than they're letting us know. They're trying to not create panic, okay? If it gets to the point of panic, you're not going to be able to get anything at the stores because it's all going to be gone. Because people are going to panic, and then they're going to panic buy. If you're smart enough and you're prepared, if you're prepared ahead of time and you took this opportunity we've been given to get out there and get some things, it's a smart move to do. Okay, I hope you guys are taking advantage of that. All right. So anyway, guys, listen, I'm going to jump off of here. I hope everybody's having a great night. We're going to see how the storm goes overnight, and we'll be interested to see what we're looking at tomorrow. But I will be live streaming tomorrow at 8 o'clock Eastern Time, so please join me then. I'll do a video, obviously, before then as well. So remember, guys, we are all in this together. That is important to remember. Also remember to hug and kiss the ones you love. Tell them every single day. Tomorrow is not guaranteed. We never know what's going to happen in life. So it's really important we tell the people that we care about every single day how we feel. Also remember, guys, STD. It's one step at a time, one thing at a time, and one day at a time. Whatever you are trying to do, whatever you are trying to accomplish, you can do it if you work methodically towards it, okay? I'm going to say again, these slippers are awesome. So to the lady that made me these slippers, thank you very much. They're very, very comfortable, and they're very warm. So thank you very much. I appreciate that, guys. I will see you all later. Have a great night. Prepper Nurse 1, out for now.